I'm here in London at a low carb and general health event which was organised by the Brazilian doctors and dietitians. So these guys have come all the way from Brazil for this, and Dr. Simon Hatro spoke here also. And one of the chief guys amongst these Brazilian docs is Dr. José Carlos Souto. Souto, okay, delighted to meet you finally.
Glad to meet you too.
Excellent. And we had a Twitter relationship, shall we say, for many years, sharing science and papers, and now we get to speak face to face. So today, Jose, I just want to talk a fairly brief interview about a couple of key things. One key thing is, you know, there are so many millions of people out there who are not overweight, who are not smokers, who are not clearly metabolically deranged. And yet these people are still exposed to sudden heart attacks and all manner of diseases. So I want to talk about what's the best way to identify middle-aged people who have really significant disease, beyond just blood tests, which are fallible.
The problem with the blood tests is when they are very altered, you know, like in people with metabolic syndrome, people that are really sick, then yeah, the blood tests will give you some hint what is happening. But for those people that you are describing, the CAC score seems to be a much better predictor than simple blood tests.
Yes, and actually I noticed you referred to it in your talk today actually, and showed the risk multipliers that for a 0 score in the calcification scan, CAC, in 10 years you've got around a 1% chance of having a heart event. But for a very high score, like over 1,000, you can have a 37% chance. So it's kind of the ultimate measure of your actual internal health. And it doesn't get used as much as it should, I think, for political and other reasons in the past. Is it used much in Brazil, do you think?
It is not used much, and it's not used nearly as much as it should. But you can order it, and the insurance companies usually will pay for it. So it is not used, but it's probably because most doctors don't think of ordering it. They just base their decisions on blood markers.
Like cholesterol and the classics, and not even blood glucose or insulin, as you discussed today.
Yes, blood glucose, yes, it's part of the general checkup that they will ask for the patients. But insulin is very rarely measured.
Yeah, I think that's common worldwide pretty much. It's something that'll probably change. I think both those things, the calcification scan is going to get big in the coming decade, and I think more testing of insulin also will get pretty big, I think.
Oh, I hope so. As for the CAC score, it can also be used in the other way around, which is to give peace of mind for those patients that have a high LDL level. But you know, those are people that are, as you said, they're fit, they are not overweight, they don't have metabolic syndrome, and sometimes you just order a CAC score and it comes 0, and you can reassure those patients that they are in a very low risk for heart disease, even though their LDL may be high.
Exactly, yeah. So it's reassuring to people who believe that they're healthy, but their cholesterol metrics are not ideal. It's an excellent result. Also the CAC, for tracking your progress, if you've got a score of say 800 and you then take action because you wake up and you realize there's a problem, you take action for a few years, watch your bloods, and then you can go and get another quick scan and see that the score has not risen, that you've been successful. I think that's really useful as well. And if someone, let's say, gets a high score, and obviously that's a major concern, what are the top things you would do, having a high calcification score, clearly with diabetic or other dysfunction and heart disease? What are the top 4 or 5 things you do in your life, given that up to that point you've just been eating the food pyramid?
Well, I would first of all get rid of the food pyramid and go for real food. Okay, so real food, getting rid of the processed food, especially the processed carbs. So a low carb diet if the patient has insulin resistance, and at least a lower carb diet if the patient doesn't have insulin resistance, but a low processed food diet, definitely. I think exercise is also something important, even though, as we now say often, you cannot outrun a bad diet. but exercise will obviously help you.
Then there's, I think one you mentioned in your talk today, the vegetable oils that are supposedly heart healthy.
Exactly. We now have randomized controlled trial evidence that these supposedly heart healthy oils are actually capable of giving you more heart attacks and more myocardial infarction. So even though your cholesterol may go down, you actually get more heart disease because they are inflammatory, right? And inflammation is actually something big when we are talking about heart risk disease.
Yeah, and I think the vegetable oils, they move a marker for some bureaucrat to be happy with, but the long-term implications, I think as well, some of the early trials in vegetable oils showed over a year or two short-term slight benefit in events, but the reality is over longer periods the damage will grow and grow. So the long-term outcome is terrible. Processed food, I like to hear you say, Jose, because a lot of people say, oh, you're low-carb zealots, and I think some people go overboard on low-carb, high-fat with loading on butter and guzzling too many fats. Whereas if we step back from it, if you just cut out all processed carbs and sugars and all processed foods with vegetable oils, to be honest, you get a long way towards recovering your health, I think.
I completely agree. And I think the pendulum has gone too far to the side of the high fat. So low carb, yes. Low processed food, yes. It is higher in fat than the average food pyramid diet that people have been eating. But we are talking about the fat that is naturally present in real food. So if you are eating a salmon, for example, you are eating a high-fat fish, but it's not the same thing as putting butter in your coffee, right?
Or the heavy double cream on everything and all that kind of stuff. I agree. If you take in healthy fats, avocado, fish, and grass-fed, you know, healthy animals that you eat, the fats come in with the good proteins, and it's real food. And you're shunning the breads and all the junk carbohydrate processed foods and vegetable oils. Put that together along with getting sun exposure, exercise, and maybe magnesium and other critical minerals, and you could transform your health very quickly.
I'm pretty sure. And then you can track your progress with something like the CAC score.
Oh, absolutely, yeah. If you have big disease, maybe a couple of years later, and if you have a lucky 0, keep doing what we say, and then maybe 7 or 8 or 9 years later you could check, because you know you're in a really good shape on the first score. Excellent. Well, any other things to add, Jose? Or I think we've covered the top 4 or 5 things there for your health.
Yeah, I would add, as we are talking about the CAC score, that people should differentiate between surrogate markers, stuff like, you know, cholesterol, that supposedly will tell you risk, and the CAC score, which is actually you are measuring the disease. You are measuring the actual disease in the coronary arteries. So that's why it's more predictive, because you are actually measuring what you want to measure.
Excellent. And as we say, if you don't measure it, it don't get fixed, and calcification is certainly a great example of that kind of test.
Excellent.
Hey, thanks a lot, Jose.
Thank you
Great
very much.
day.
Thank you.